Hi everyone. If you're a nursing student and have ever wondered when you actually need to do a medication dosage calculation, you're in the right place. In this video, I'll walk you through the key situations where med math is essential, both in school and in clinical practice. Let's get started. So when do you need to do a medication dosage calculation? Whenever the medication order, what the provider prescribes, does not exactly match the form or concentration of the drug you have available. In other words, if you can't just administer the medication as is. Let's review 6 situations when you need to calculate the dosage. First, when the ordered dose differs from what's available on hand. For example, the order reads 500 milligrams, but the medication available is 250 milligrams per tablet. You need to calculate how many tablets to give. Second, when ordered and available doses are in different units, you need to convert units before calculating the dose. For example, the order is for 1 gram of a medication, but the available medication is 250 milligrams per milliliter. You would need to convert the grams to milligrams. Third, when the order is based on the patient's weight, you will need to calculate the dosage by multiplying the ordered amount by the patient's weight. For example, the order reads 5 milligrams per kilogram per day for a child who weighs 12 kilograms. You'll need to calculate the total daily dose by multiplying 5 milligrams times 12 kilograms to calculate the prescribed dose. Fourth, when using IV infusions. It may be just to calculate an IV infusion rate, such as when the order reads 1,000 milliliters of normal saline to be infused over 8 hours. You would calculate the infusion rate for milliliters per hour. But it may also be when calculating the flow rates for medications, like heparin or dopamine, where the order is often in micrograms per kilograms per minute. Fifth, when converting between dosage forms. For example, going from IV to oral or from tablet to liquid. A patient's prescribed 1 tablet of a 250 milligram medication, but they can't swallow their pills. You would have to change to a liquid version with 125 milligrams per every 5 milliliters. You would have to calculate the amount of milliliters to administer. Sixth, with pediatric or neonatal dosing, you need to calculate the maximum and minimum dose limits, and you need to calculate weight-based dosing and body surface area dosing. When do you not need to calculate dosage? When the order matches exactly with what's available and appropriate for the patient. For example, the order is 1 tablet of 500 milligrams of acetaminophen, and that's exactly what you have. Here are some tips for when trying to decide if a calculation is necessary. Read the entire medication order and label before administering. Look for the concentration, the dosage, form, route, frequency, and patient specifics. Sometimes the information you need is hidden in the details. Always check your units of measurement to make sure they match. And ask for help when unsure. If a dose appears unusual or you're unsure, double check with a pharmacist or a nurse educator before administering. Thanks for watching. If this video was helpful, give it a like. Share it with your classmates or coworkers, and subscribe for more nursing education content. You can find more videos at nursevideohub.com. Watch, learn, and care.